Good morning, everyone. Thank you all for joining us today for the 20th anniversary of 9/11 Town Hall as we commemorate the day that changed many of our lives forever. Today, we plan to share some research findings and lessons learned from our World Trade Center Health Registry that we hope can save lives and reduce injuries for future disasters. My name is Charon Gwynn. I'm the Deputy Commissioner of the Division of Epidemiology here at the New York City Health Department. And this is where the World Trade Center Registry is housed. We have an agenda that we have planned for you, but before we jump into the agenda, I would like to welcome our Commissioner of Health, Dr. Chokshi, who will share some opening remarks. Dr. Chokshi, as many of you may know, is the city's doctor, and he, since joining the agency last year, has been fully immersed in the response to the COVID pandemic and ensuring that all New Yorkers are getting vaccinated. In his work here, he draws upon his expertise as a primary care physician, as well as his experience that spans public, private, and nonprofit sectors. He has, in addition to prioritizing the work of the COVID pandemic and the vaccination campaign, he's also prioritized what we call the parallel pandemics, which include chronic disease, mental health, race inequity, and economic and social instability. He certainly values the role of public health surveillance to monitor trends and emerging concerns, and has also prioritized work across public health and healthcare systems to address physical and mental and social determinants of health concerns. He also recognizes the importance of engaging community stakeholders and community partners. And all of these are really important priorities to helping the work of the World Trade Health Center Registry and keeping our work going. So without further ado, I'm very excited to welcome Dr. Chokshi to share opening remarks. I will turn it over to you now.
Thank you very much, Dr. Gwynn, for that kind introduction. Good morning to everyone. I'm just truly honored to be part of this important event commemorating the 20th anniversary of 9/11 and paying tribute to you, to the more than 71,000 enrollees of the World Trade Center Health Registry. First, let me start by thanking all of today's presenters and also everyone who has made the registry such an inestimable model of public health practice and also of humanity since its inception in 2002. I'm so proud that the New York City Health Department quickly understood and acted on the need to track, assess, and support both the short and long-term health concerns and needs of those who are directly exposed to the 9/11 disaster. Although the World Trade Center Health Registry is the largest post-disaster registry in United States history and among the longest running, the magnitude of its lessons and impact are limitless and ongoing. We continue to learn extraordinary lessons about the large-scale physical and emotional consequences of that terrible day, about the individual stories, battles, and triumphs that lie underneath the science and statistics, and about how each of those individual experiences interweave with the fabric of families and society as a whole. These lessons spur us forward to learn more and understand better the patterns and ramifications of tragedy and survival after disaster strikes. We'll hear more this morning about some of what we've learned and about where we're headed next. I'd like to take a few minutes first, though, to place the registry in context. And of course, it's not lost on any of us that this occurs at a time when another public health disaster, the COVID-19 pandemic, is both expanding what we know about trauma and recovery and also distilling it to its essence. The nature and effects of trauma may be the lasting lessons from the registry's first 2 decades, and the standpoint from which we may best view our current situation with COVID. I have little doubt that the registry's volunteer enrollees have contributed to a wholesale shift in how to treat and care for survivors of trauma in all its forms. Once, public health and care providers' clinical approach to trauma was largely contained under the umbrella of post-traumatic stress disorder, PTSD, which we've discovered in part through the registry gives short shrift to what most of our enrollees faced. What our registry studies have taught us is that trauma is pattern-defying. Its length and onset varying. It's always multidimensional, usually multi-symptomatic, and often even psychologically strengthening. The quote-unquote good news of post-trauma growth that you'll hear a little more about later on. As a result, the registry's enrollees have been critical in advancing trauma-informed care, a whole person approach which takes into account a person's unique history and totality of trauma, be it terrorism, violence, racism, personal abuse or neglect, poverty, or say a pandemic. But while the registry will always continue to provide us invaluable insight into the many and varied health effects of disaster and trauma, its heart remains all of you, the enrollees. Since 2002 and throughout COVID, our enrollees and every individual most directly impacted by the tragedy of 9/11 have remained in our thoughts and in our work, prioritized not only because of what they can teach us, but because of the grit, fortitude, compassion, and dedication they have demonstrated without fail these many years and counting. Whether heroes from day one, like the first responders and others who place themselves in harm's way to help others, or the bystanders who have become heroes and are helping others by virtue of their openness, participation, and selflessness, you have never been forgotten. And our gratitude and commitment to you have never waned. And it's deeply personal too for many of us who have been privileged to bear witness and to help take care. As part of my own primary care practice at Bellevue Hospital, I helped care for several patients who were also being treated at the Bellevue World Trade Center clinic. I remember their stories, and I remember the emotional and physiological complexities of their symptoms and treatments. I learned so much from them about joy, about facing the unknown, about patience and acceptance, and about life-affirming resilience. On a more clinical level, I remember that they often had complicated pulmonary conditions. For instance, we were unsure whether one particular patient had asthma, emphysema, or some other pulmonary condition. That uncertainty was humbling, and it taught us all about the limitations of our profession, but also how to navigate compassionately within them, always centering the experience of the individual as our North Star with respect to whether we were actually making a difference, even and perhaps especially when our patient defied textbook categorization. I also remember my admiration for the team-based multimodal approach to care that the World Trade Center Clinic represented. Not just doctors of different specialties, but also psychologists, physical therapists, and social workers. All of these lessons and many more have influenced my worldview, especially in my role as a public health leader, through which I can hope to contribute to a transformative infrastructure of care. And these lessons are notably resonant now. If anything, COVID has made us more attuned to the intricacies of emergency preparedness and response, or the after effects of trauma, and of the urgent need to address crises and the humans caught up in them with a variety of interconnected approaches, but above all, with deep humility and humanity. This has been true, certainly, the past year and a half, and it will be true as we confront the long-term consequences of the pandemic, including long COVID and mental health vulnerability. We know we need to take these seriously, and as obvious as that may sound to most of us, it's really because of what you, our registry enrollees, have taught and given us that it is obvious at all. It's easy to forget what we didn't know and what we took for granted 20 years ago. And thanks to your continuing participation and the continuing dedication of our registry researchers and staff, we can only imagine what will seem obvious to us 20 years from now that we do not know today. I know that the current situation in Afghanistan, not to mention the other roiling political and environmental crises that we're facing around the world and right here at home, are reviving fears and apprehension among many of you, as they are many of us. We promise to keep working alongside you no matter what develops. We promise to keep delivering information and care that promotes your health and well-being. And we promise to keep honoring you as people and priorities. We owe you that and so much more. I'm looking forward to the rest of today's roundtable, and I'm looking forward to many more years of mutual education, care, and growth. Thank you so much.
Thank you so much, Dr. Chokshi, for your really thoughtful words and for your insights into the value of the registry and the enrollees in this work. I also wanted to add my own gratitude with yours to express to the enrollees their contribution and of time, energy, and their own personal stories. This information has really helped us to understand through health surveys, has helped us understand, track, and monitor health conditions among people exposed to 9/11. And more specifically, we look at this data over time through the surveys that we conduct with the enrollees to track and investigate illnesses and also to create guidelines that save lives for future settings. So today you'll hear more about some of these important findings that have come out of the registry work from some of the people who have been working on this for many since the inception of the registry. And I wanted to just quickly introduce the panel now to you. So in addition to Dr. Chokshi, we have Dr. Mark Farfel, who is the director and principal investigator for the World Trade Center Health Registry. We have Dr. Robert Brackbill, who is the director of research and surveys at the registry. We have Dr. Jim Cohen, who's the medical director and lead of the medical surveillance team within the registry. And then finally, we have Jacquelynn Osoro, who is a manager of public affairs at the World Trade Center Health Registry. So thanks to each of you for joining us today and looking forward to the morning's discussion. Our agenda, which is posted, I think, on the slide now, will be, we'll cover this in about a half an hour, we think. We're going to talk about first the registry background. We'll then highlight some main findings. We'll turn then to some lessons learned from our findings, and then we'll have some time for questions and answers at the end of the presentations. And then we will also share some 9/11 related resources with you. So I think we should jump in. So without further ado, we'll turn it over to Jackie, who's going to describe the registry background for us.
Thank you so much for the introduction, Charon, and thank you, Dr. Chokshi, for joining us this morning. I will quickly just walk you through the registry background. So the registry was established in 2002 with federal government support and is based in the New York City Health Department. As Dr. Chokshi mentioned, it's the largest post-disaster registry in U.S. history and one of the longest running in the world. In 2003, we began tracking the short and long term, and by long term, we mean over 20 years, health of more than 71,000 people who voluntarily enrolled and were directly exposed to the 9/11 disaster in New York City. Those are the people we call our enrollees. Since 2003, we have conducted 5 major health surveys with enrollees over time, including the most recent one, which was in March of last year and just got concluded sometime this year. We have also conducted shorter surveys that have focused on specific conditions, including autoimmune disease and COVID-19, as well as more in-depth studies that we've conducted on things such as disaster preparation after Hurricane Sandy. Our survey creation is a collaborative one and community-centered. We work with a community, labor, and scientific advisors, and collaborate with the World Trade Center Health Program, which is where enrollees and other people exposed to 9/11 get healthcare. And we also work with other healthcare providers and researchers. We share our scientific findings with enrollees, the public, and other stakeholders on 9/11 related physical and mental health outcomes, gaps in care, quality of life, functional status, job loss, and early retirement, among other findings that you'll hear about today. Our findings help inform healthcare policy for people exposed to 9/11, not just our enrollees, and also helps with future disaster preparedness and response. I think Dr. Farfel will be speaking more about this later. Our registry also serves as a platform for approved 9/11 related research by other researchers outside of the registry. This work extends the scope and depth of registry work and also, again, helps inform healthcare. And now I'll send it back to Charon to introduce. Are you introducing Mark? Or Mark, do you want to just jump in?
I'm here. Sure, I'll just jump right in.
Okay.
And first, I want to add my heartfelt thanks to all of our enrollees for participating in our surveys and showing so much dedication to the registry over the years. And your help is really invaluable to learning about the health impacts of 9/11. We obviously couldn't do it without you. And we hope that you'll continue to participate in future registry surveys as we now enter the third decade since 9/11. And the registry does plan to continue operating for many years to come under the James Zadroga 9/11 Health and Compensation Act. And this is the act that also funds the World Trade Center Health Program that provides monitoring and treatment for 9/11 related conditions for eligible responders and civilian survivors. While our registry was not designed to provide clinical services, we do continue to collaborate with the World Trade Center Health Program, their doctors, their researchers, and we respond to enrollee healthcare needs and concerns, and because we see this as a core part of what we do. And we will continue to reach out to our enrollees to encourage and help them apply to care through the health program. We'll also continue to provide 9/11 related health materials, findings, and resources to our enrollees and the public through our website and our newsletters and through social media. And later on, we'll provide information on how to contact the World Trade Center Health Program. So next, I want to mention who was eligible to enroll in the registry in 2003 and 2004, because it's so critical for understanding our work and our findings. And the registry was designed to include people who were likely to have been highly exposed to the 9/11 disaster in New York City. And these included people who lived, worked, or went to school in Lower Manhattan, passersby, and people in transit in Lower Manhattan on the morning of 9/11, as well as rescue recovery workers. After an intensive period of outreach for recruitment into the registry, enrollment ended in 2004. And at that point, the registry had successfully enrolled more than 71,000 people. And among them were more than 14,000 residents of Lower Manhattan, more than 3,100 children who were living in Lower Manhattan or going to school, K through 12th grade in Lower Manhattan, more than 43,000 building occupants, area workers, and passersby, and more than 30,000 rescue recovery workers and volunteers. Of note, some people fall into more than one of these groups, which just illustrates the complexity of people's exposures to 9/11. So, for example, some residents were also area workers or responders. One of the strengths of the registry is that we have diverse groups of responders and civilian survivors, including WTC Tower survivors, responders who worked on the Staten Island landfill, and cleanup workers. And we also have the largest cohort of 9/11 civilian survivors. We have enrollees from every state, which reflects in part the fact that responders came to New York City from across the country. And we also have enrollees from more than 15 other countries. And overall, we have nearly 1 in 5 of the estimated 400,000 people who are eligible to enroll in the registry. So far, the registry has more than 150 publications reporting on a range of physical and mental health outcomes and 9/11 consequences, and our papers are listed and summarized on our website. So what I'll do now is briefly mention some main findings and lessons learned. And first, the 9/11 WTC disaster has had enduring and significant impacts on survivors' physical and mental health, health behaviors, quality of life, and functioning. And the most common 9/11 related conditions are post-traumatic stress disorder, PTSD for short, depression, asthma, gastroesophageal reflux disease, GERD for short, and upper respiratory conditions such as sinusitis. And these conditions often occur together. That's a hallmark of 9/11 conditions. Many people have more than one 9/11 related mental health condition, or more than one physical health condition, or a combination of physical and mental health conditions. For example, people suffering from PTSD often have depression, others have asthma and GERD, and or PTSD. And we've found that having more than one of these conditions has a greater impact on quality of life, functioning, how people think about their own health, and unmet healthcare needs than having one condition alone. And the impact on quality of life and functioning grows larger as the number of 9/11 related conditions increases. And now I'll turn it over to Dr. Brackbill, who will speak about selected physical and mental health outcomes.
Good morning, everyone. I'm really pleased to have this opportunity to, provide some detail on, some of the research we've been doing. It's also, for me personally, it's been a privilege, to be working with the registry. I was actually there at the start in discussions, about the conception of this major long-term study that we have. I will review some detail of the findings, and I'll repeat, some of the things Dr. Farfel mentioned and say a little bit more about them. I guess I want to see the slide. It kind of gives a little bit idea what I'll be talking about. Can I show the slide? Okay, thank you. Respiratory conditions have been a prominent problem for a person exposed to environmental contaminants. And these are people who were present on the day of the attacks and afterward. We especially have responders who perform rescue recovery work and cleanup, for up to a year afterwards. I think we sort of officially say the end of it July 2002. They worked on both the WTC site and the pile. We also have people who were caught in a dust debris cloud. And this was an immense, contamination and immersed people in the remnants of the buildings after they collapsed. They're actually, each building, collapsed separately. So they're really two debris clouds. And we have over the years used what we refer to as an intense experience of dust debris. And also, those who worked and lived in the area, residents lived nearby, people who worked in businesses, and also occupants of the buildings who evacuated. And then we have, also children, who were in school. As Dr. Farfel mentioned, we include in the registry children who were enrolled in schools in that area from K to grade 12. This is still evident, particularly evident up to 15 years after 9/11, that we still find 15% enrollees had reported asthma that was diagnosed after 9/11. Also, of those people who have, asthma, even 15 years later, 72% of them still had wheezing, cough, and shortness of breath. Now, also, I'll speak a little bit about gastrointestinal reflux disease, which has also been a very prominent, problem that people had to deal with, since 9/11. Gastrointestinal reflux disease, or GERD, is a frequent heartburn or acid reflux over a long period of time. I think typically it's 3 months, up to a year, and it's one of the most common conditions reported among persons exposed to the 9/11 disaster. 22% of adult enrollees reported being diagnosed with GERD 16 years after 9/11. This condition also co-occurs often with asthma and post-traumatic stress disorder, which are both, strongly related to 9/11 disaster exposure. And one of the interesting things about it is asthma and GERDs are related to each other, but it's PTSD that plays what we refer to as a mediating role, in connecting the asthma and the GERDs conditions. I can show the next slide, the mental health conditions, please. So I'll be talking about mental health outcomes that we've been looking at. So we have mentioned that post-traumatic stress disorder is one of the most prevalent problems among enrollees that we have been following for the last 17 years since the registry started collecting data. This condition is defined. This is a condition that's defined by a person experiencing a life-threatening and traumatizing event that's outside their normal routine experience. It is characterized by intrusive and distressing memories of the initiating event, difficulty in relationships, sleep disruption, hypervigilance, and withdrawal. Hypervigilance is actually, where a person, you hear stories about people who might have been exposed, to combat or something, and then they hear a loud noise and they jump and they act as though they're still in combat. The registry has been tracking the symptoms of PTSD since 2003 and has found that although many people have resolved post-traumatic stress disorder over the years, there's still about an 8 to 10% of enrollees who report symptoms, on the surveys. And we use a scale in order to do this. And the symptoms, up to a point, where we define them as having symptoms that indicate post-traumatic stress disorder. Some are exhibiting delayed PTSD. That is, we still see some people who didn't show post-traumatic stress disorder for many years, and then they endorse the symptoms, and then they exceed that level. About 4 to 5% have persistent or chronic PTSD among those that we've been following all this time. One of the main factors, other than the intensity of exposure, has been the persistence over time, has been the loss of job because of 9/11. There are certainly other factors, ethnicity, for instance, Hispanics tend to have higher levels of post-traumatic stress disorder. But it seems that, job loss is just a major contributor to persistence over the years in chronic PTSD. Just an example here, we found that among rescue recovery workers have a 16 times greater likelihood of having persistent PTSD than those who didn't have a 9/11 related job loss. So we're talking about PTSD and sort of, other associated problems that come as a result of that. People with PTSD suffer in multiple ways. Just overall, their quality of life is adversely affected, and that they're generally unable to work, form satisfying social relationships, and usually, as we have found, have exacerbation of other 9/11 health problems, such as lung problems, or they develop comorbid major depression. A recent paper that we published showed that those with post-traumatic, 58% of those with post-traumatic stress disorder had major depression. We've also documented among persons with PTSD symptoms increased likelihood of tobacco use and alcohol consumption. Recently, we've addressed also opioid use and found that is associated with PTSD, and body weight tends to increase as well. PTSD and lower respiratory symptoms influence the occurrence of each other. We've done studies in which we found that certain lower respiratory symptoms trigger post-traumatic stress disorder, and that the reverse also happens. Overall, health affects the occurrence, of both of those conditions. And also, people tend to engage in maladaptive behaviors, such as alcohol and tobacco use, that exacerbate, the LRS and the PTSD lower respiratory symptom, combination. We also, looked at retirement, for instance, and other, effects on quality of life. And that persons with chronic conditions, especially in combination with PTSD, are much more likely to retire early, which is defined as retiring before the age of 60. And, retiring early because you don't want to retire, you tend to have a lower income as a result, and then it spirals up, to affecting your quality of life in addition to the other problems. All these concomitant effects of PTSD symptoms results in also all cause increase in the chances of mortality, all-cause mortality, and also specifically heart disease and external causes of death, such as unintentional accidents and drug overdose. So now I'll be talking about other aspects of mental health effects that we've looked at. It is also important to consider, mitigating factors related to PTSD and other mental health problems such as depression. For instance, we have found that social support, such as having someone available to help a person deal with problems, with social integration, which is based on the number of contacts with others that a person has. We have also evaluated the role of treatment in mitigation of mental health problems, including PTSD, and found that 37% of enrollees have sought counseling after 9/11. And that it's interesting to find that those with very high exposure rate the counseling as being very helpful. The reduction of symptoms of PTSD through appropriate treatment would ultimately result in mitigating other health and behavior impacts. However, we've not been able to, in our work, it's difficult to relate, whether treatment in PTSD, or treatment really reduces post-traumatic stress disorder symptoms. Okay, so I think our next thing I want to talk about is just our work on children. So we can show that next slide then. Thank you. Children of 9/11 who were persons, who were younger than 18 in 9/11 are considered a priority group, by the registry, and especially for tracking long-term effects. Children in the registry were either residents of 9/11 or they were enrolled in schools in the World Trade Center area. And the World Trade Center area, I don't know, it's been mentioned, is south of Canal Street, if you're familiar with Lower Manhattan. Special emphasis has been placed in this group. In that, of course, the registry has conducted what referred to as pediatric follow-up surveys, and we've done 2 of these. And these surveys are set up to gather information from both the parents and also from the children. And in the most recent pediatric follow-up survey, we had a questionnaire that was, directly filled out by adolescents. For the most part, 9/11 children experience the same 9/11 related health conditions adults do, including elevated occurrence of asthma, PTSD symptoms, and increased use of tobacco and substance use. We also found that the mental health of parents who've been exposed to 9/11 influences their children in negative ways, such as behavioral problems or difficulties in school functioning. Women pregnant in 9/11 who are also at a higher risk of adverse birth outcomes, including low birth weight, preterm deliveries. The registry has contributed to a number of external studies on exposure and physiological biomarkers for potential health issues among children and underlying vulnerability to mental health and behavioral issues. Now I will hand this over to Dr. Cohn, who will now talk about findings in post-traumatic growth and emerging health conditions. Thank you.
Yes, thank you very much. And I really do, again, thank the enrollees, those who have really persisted in participating in our surveys and made possible all the results that you're hearing about today. As Dr. Chokshi mentioned, some enrollees did experience more positive psychological growth after 9/11. This growth can take many forms, from understanding better people who have suffered similar kinds of events, recognizing new opportunities, seeing that maybe there are things in life that they want to pursue that they didn't think of before, having a greater appreciation for life in general, feeling that having lived through that terrible event, they can face the future with more confidence, and they may feel an enhanced sense of personal growth or personal strength. People who were enrollees who experienced personal post-traumatic growth after being injured on 9/11 tend to have higher social integration and social support, as Dr. Brackbill mentioned. And also, as Dr. Chokshi mentioned, as humanity, we're experiencing new challenges every day, from the consequences of climate change to the turmoil from the continuing COVID pandemic. People with who are victims can consider, and treatment for those victims can consider post-traumatic growth and how it might help them face the adversity and be able to understand how interconnectedness and the social support can play a role in their future. The registry also is alert to emerging conditions associated with 9/11 exposure. For example, pulmonary fibrosis. We found that the World Trade Center dust exposure among rescue and recovery workers increases the risk of pulmonary fibrosis. This is a scarring condition of the lungs that takes many years to develop. Some of the toxic chemicals that we identified in the World Trade Center dust, such as heavy metals like titanium, silica, asbestos fibers, and wood dust, have been linked to pulmonary fibrosis. Another condition is systemic autoimmune diseases. These are a concern of our advisors and enrollees who contacted us many years after 9/11. We did a follow-up survey and confirmed the cases by contacting those of you who have this to get your permission to contact your physicians and obtain medical records. And those with intense dust cloud exposure or rescue and recovery workers had 2 times the likelihood of having a medically confirmed case of systemic autoimmune disease, which includes conditions such as rheumatoid arthritis, lupus, and Sjogren's syndrome. Community members with post-traumatic stress disorder were 3 times more likely to have a systemic autoimmune disease. There are many other, what we suspect maybe in the future, emerging conditions. One that we thought about initially was hearing loss, given the tremendous sounds of the collapse of the buildings and the dust. We did ask about this in the first survey we did, and we published a paper early on that did suggest a possible link with 9/11 exposure, but we really didn't focus on this problem until an enrollee who happened to be a musician contacted us just a few years ago, and he'd become deaf after 9/11 and asked us to evaluate this problem further. We did find that exposure to 9/11, building collapse, and the dust cloud was associated with hearing loss or hearing problems in both rescue and recovery workers and community members who were highly exposed. Now, the registry also continues to track cancer and mortality. So I'll just mention briefly that we were planning to track cancer and mortality from the very beginning. We did find in our survey of 10 years since 9/11 that the rate of cancer overall was slightly higher than expected, and there were a few causes of cancer that were increased. Thankfully, in our most recent study, we found that overall mortality was not elevated among enrollees. Next, we'll hear from Mark Farfel about a special feature of our registry called the Treatment Referral Program. Mark?
Thank you, Jim. We've covered a lot of health impacts, and I think it's important at this point to note that some people with 9/11 related symptoms and unmet healthcare needs are not yet enrolled in the World Trade Center Health Program. And we've learned about some of the barriers to care, and they include people just not being aware of the World Trade Center Health Program, or people not realizing that their symptoms may be related or connected to their experiences at 9/11, or people thinking that Others just deserve care more than they do because they perhaps might be suffering more. Others worry about the stigma that is associated with having a mental health condition, and yet others need some assistance with the health program application. So to address these needs, we've been operating for some years now a treatment referral program. We have staff who are trained to help enrollees address these barriers and apply to the health program. And so far, fortunately, thousands of our enrollees have responded to this type of personalized outreach and have made an application to the World Trade Center Health Program. And that makes the registry an important source of new applications, both from responders as well as non-responder civilian survivors, including Spanish and Chinese speakers and other groups who are underrepresented in the health program. So at this point, I want to briefly mention some other lessons learned before we move on to the Q&A. And some, as Dr. Chokshi has mentioned, are relevant to tracking COVID-19 health impacts. And our registry experience shows the importance of establishing registries early on after a disaster, and the importance of including both community members and responders to help inform healthcare and disaster response. We've learned a lot about how to keep enrollees involved through ongoing communications, and not just during the time of our surveys, including the newsletters, videos, health materials, and the website, and by getting enrollee feedback on our materials. We also learned that responding to enrollee health needs is a key to a successful registry. It helps enrollees get care, it shows that we care, and it shows how registries can participate in long-term disaster response. Additionally, evaluations of disaster impacts should extend over time and include long-term impacts on health as well as functioning, quality of life, and other consequences. It's important to understand disaster impacts among diverse populations of people exposed to a disaster. For example, we found that volunteers with little or no disaster or training experience were more likely to have PTSD compared to professional responders. With community input on our surveys, we've strengthened our ability to track health impacts among different populations, and we're finding ways to expand our equity-focused work to keep diverse groups of enrollees engaged for the long term. Understanding the impacts of subsequent disasters is also important, and this is the reason we conducted a survey of our enrollees following Hurricane Sandy a number of years ago, and more recently, we conducted a COVID-19 survey to understand the pandemic's impacts on our important cohort of 9/11 survivors. Over the past 20 years, we've also adapted to major technological and social changes in terms of how we communicate with enrollees and collect survey data while maintaining data security and enrollee confidentiality. Lastly, it's important to limit hazardous exposures during and after future disasters, including measures to protect both responders and civilian survivors, such as shorter work shifts, providing adequate respiratory protection, and timely cleanup. Jackie, I'm not sure if you're going to present the slide on 9/11 resources now, or we're going to do that after Q&A.
We'll do that after Q&A.
Okay.
So I have a few questions for all of you, if we can get through all of them. The first question is for Dr. Gwynn, Charon. What has been the greatest achievement of the registry?
Thank you, Jackie, for that question. You know, I think it's hard to just pinpoint one achievement, but I think really when we think back about all of what was entailed in setting up the registry and getting over 70,000 people enrolled in a short time span, I think that that really is one of the key accomplishments. The ability to have one of the largest and longest registries in the country that is really an invaluable resource for both the public health community in terms of the research that we do, but also how we use this information and disseminate it to get it back to the community who is most interested in it, and also from the public health practitioners who can use this to make change. I also think about the guidelines that we were able to work with our World Trade Center expert collaborators to produce that help inform how people who have been exposed to 9/11 are treated in the clinical setting. And then also thinking about the enrollees themselves and the resources that we provide to enrollees, including a connection to the World Trade Center Health Program if needed, as well as other materials and resources that we share through our website, through our newsletters, and through our outreach with enrollees. And I know that we'll share some more of those here today after the Q&A. So many great accomplishments, but really just the enormous effort and contribution of the enrollees I really want to highlight.
Thank you, Dr. Gwynn. The next question is for Dr. Farfel. Mark, what are the next steps for the registry?
Well, in the coming years, we plan to conduct another survey to get health updates from our enrollees 22 to 23 years after 9/11. We also plan to conduct a COVID-19 follow-up survey to understand more about how COVID-19 illnesses and experiences may affect the course of our enrollees' 9/11 related health conditions. And we're also planning to assess aging and cognition as the registry cohort ages. And we will analyze the responses to the registry's 2020-2021 health survey and the recently completed COVID-19 survey and publish our findings and share those findings. Our treatment referral outreach will continue together with the other kinds of communications with enrollees and the public that Dr. Gwynn has just mentioned.
Thank you, Mark. The next question is for Jim, I believe. Do other registries track the health of people exposed to the 9/11 disaster? And if they do, or if they exist, how does the registry work with them?
Yes, thank you. There are 4 other registries tracking the health of people exposed to the 9/11 disaster. First, probably people are aware that the Fire Department of New York City established a registry shortly after 9/11 to follow all the fire department workers who responded to the disaster. The second is the World Trade Center General Responder Clinics, made up of Mount Sinai School of Medicine clinics, NYU, Northwell Health, Rutgers University, and the State University of New York Stony Brook Medical Center. All have combined to track the rescue and recovery workers. The World Trade Center Survivor Clinics, including Environmental Health Center that follows community members based at Bellevue, Gouverneur, and Elmhurst hospitals, and the William Street Clinic follow the community members who have been affected by the disaster. And finally, the nationwide provider network. It's a unique network of clinical centers all around the U.S. who take care of those who moved out of the New York City area, who came from other areas to help with the cleanup and the response. All these are funded through the World Trade Center Health Program at the National Institute for Occupational Safety and Health. And the World Trade Center Health Registry works closely with these programs through the Responder Steering Committee and the Survivor Steering Committee. They have monthly meetings, and we collaborate on research projects such as the Joint Cancer Project, the Joint Mortality Project, and we also combine our efforts in a committee to revise the clinical guidelines that Dr. Gwynn mentioned. Many of our publications include co-authors from the other cohorts. So we really do see ourselves as both a very useful resource for the World Trade Center Health Program, but also collaborator in many of the research projects. Thank you.
Thank you, Jim. The next question is for Dr. Brackbill. Robert, how did people find out about and sign up for the registry?
Oh, yeah, thank you for that question. Before the registry actually started, before we began enrolling, interviewing people, members of the registry development team met with many different individuals and groups and answered questions and addressed, concerns about the registry. And these groups included such things as community boards, organizations such as Downtown Alliance, sanitation, police department, fire department, Red Cross, and just many more, tenant organizations, etc. And we also, spent a lot of time, even before we began, interviewing people, obtaining lists, by contacting hundreds of different organizations and asking them to send us lists of people who they thought were potentially eligible for the registry. Some ended up sending us lists, but many, told their employees through different methods, about the registry. Like for instance, the police department put in little messages in their paycheck envelopes or whatever, saying enroll in the registry. We and also before enrollment, there was an extensive advertising campaign. We used every means available to reach people, through subway ads, radio ads. We handed out thousands of leaflets. We had people who were walk through downtown and drop leaflets off at different businesses and coffee shops and whatever. People stood in the entrances to the subway and handed out, PATH train, because there were many people who came from New Jersey, who were, exposed to the 9/11 dust cloud and also were there at the time of the attacks. So we handed out leaflets to people who were commuted from New Jersey, for instance. And these advertisements included an 800 number that people could call up and when they made the phone call, somebody would answer, and then they would then go through the process of first, consenting, and then agreement to do the interview. The folks on the list, we contacted directly, and we tried many times to call them and reach them through, what information we had. And there were also instances in which we would go to places, where people were and interview them directly. It's like in Chinatown, we went to different community centers. We visited, fairs. We actually had a number of people went around to the fire department, individual fire department stations, and collected names of firefighters. This was towards the end of the enrollment period. So it was just an enormous effort, that happened in the months before we interviewed, and also during it continued on, while we're doing enrollment and interviewing. And that's how, we achieved, really a large number of enrollees, 71,000 agreed to be on the registry. And of course, I want to, sort of, say that, there's folks who enrolled at the beginning and stuck with the registry. It just really is an important contribution to community and to science. And we really, are appreciative, of their continued involvement in this important work. Thank you.
Thank you, Robert. Mark, in just 1 minute, if you could tell us how COVID has affected the registry and its work.
Sure. The registry recognized early on during the pandemic that this was going to have a major impact on our enrollees as well as the general society. And so we began designing the survey to administer to our enrollees to understand their illnesses and their COVID-19 experiences, so we could begin to take that into account in understanding their ongoing 9/11 related health impacts. And I would also say that like many other staff at the health department over the last year and a half, registry staff have been activated in their COVID emergency roles, doing things, a wide range of things from provider communications to surveillance to data analysis and staffing the vaccine hubs for COVID-19. And of course, like everyone else in New York, our staff are also experiencing the COVID pandemic in their own ways. And I think we've managed to just continue on through all of these challenges to maintain the core functions of the registry, and that is the research, our communications with our enrollees, dissemination of findings, and our treatment referral work.
Thank you so much, Mark. Thank you, everyone on the panel, for your presentations this morning. And thank you, all of you, for joining us whenever you get to watch this town hall, whether you're watching it now or watching it later. Again, I just want to thank everyone, as everyone on the panel has said, that the registry would not be where it is today. We wouldn't have the kind of success we have without the participation and commitment that we've seen from enrollees over the years. So if you or a loved one or someone you know was impacted by the 9/11 attack, there are resources available for you. We have the World Trade Center Health Program, which is the federal program that provides monitoring and treatment, including medications for physical and mental health conditions related to 9/11. You can apply online at cdc.gov, or you can call the number that's on the slide that's up on the screen right now, 888-982-4748. And if you're an enrollee, we can also mail you an application. There is also the September 11th Victim Compensation Fund, which provides compensation to individuals who were present at the World Trade Center or the surrounding New York City exposure zone. Both programs also provide care for people who were at the Pentagon crash site or in Pennsylvania, in the Pennsylvania crash site at the same time on September 11. The information for the VCF is also on the slide. It's vcf.gov, or you can call their helpline at 1-855-885-1555. And if you're an enrollee, you can always call us at the registry or email us if you need any help or guidance. I don't know if Charon, do you want to close?
Thank you so much, Jackie. And I just wanted to, again, thank everyone for taking the time to experience this town hall, whether it's live or later. We hope that it was helpful for you. And thank you all for your participation in the registry once again. I want to thank the panelists who participated in today's meeting, as well as Dr. Chokshi. And I hope that you will visit us on our website, which I think we can post later if we don't have it now, to learn more about the registry. And thank you all, and have a good day.